agitated people you could really come across. But first, let's break it down to someone who's just has no major medical problem or psychiatric problem and becomes agitated. Let's divide it up into adult, adolescent, and child. If it's a little child, you could talk them down simply by talking in a calm voice and asking them what's upsetting you at their eye level. This is, say, under 12, under 10. What's upsetting you? And then see if you could work the problem out with them. That usually works. But when they progress to adolescent level, let's say 11-ish, 12, people mature quicker now, to let's say 17, at that point, hormones are kicking in, adolescent, just chaos. At that point, the gray matter is not fully formed in the brain and they're erratic. So I treat adolescents. That's most of my practice. You're dealing with an adolescent. You're really not going to negotiate when they're in that emotional, chaotic, agitated state. Talk calmly and don't insult them and say, we'll talk later. Nothing will get resolved with an adolescent because they're too erratic. You will not negotiate with them. When they calm down, you will deal with them and trying to sort of negotiate or bring about a therapeutic change. It's usually through a reward system, saying you won't be punished, but you will not be given privileges or rewards should you continue on with that behavior. But when they're emotionally excited, yelling, screaming, you don't understand me, you don't look at me objectively, I hate you, nothing will get accomplished with an adolescent. With an adult, it's a different ball game. Agitated adults, by and large, could be dangerous. What agitates an adult? It could just be they're angry, in which case, ask them what's upsetting you and what can we do to make things right. You talk in a very calm voice, don't get in their face, don't make demands, and try and talk them down by getting into the root cause of what's going on. You have to be very careful here, because with adults, you have to be going through a whole series of checklists. If they're in drug withdrawal from marijuana, alcohol, cocaine, amphetamines, benzodiazepines, opiates, you have a whole nother problem. You're not going to deal with that problem. That problem will be addressed by giving them some sort of a detox med, or they're going to have to detox. They will not be right until the detox is over. If they're high, you really can't negotiate with these people and they could be dangerous. So that's something you have to make an assessment of. And you can ask them, are you coming off any drugs or alcohol? If you see signs of tremor or dilated or constricted pupils or sweating or malodorous or disheveled or they smell of some kind of chemical, facial acne, steroids can even do this. So hopefully you can pick some sign of drug use that will lead you. If they have nicotine on their breath, tobacco, high probability they're doing some other drug too. So that would be the drug withdrawal, drug intoxication. Then you have, what are the reasons that people get agitated medically? Big ones, autism, autistic people on the spectrum, too much stimuli, get very agitated. And the best thing to do is to remain quiet and get them in a quiet place. You have to know they're autistic. And that's not so easy to identify, but you could ask them, are you on the spectrum? And then that would lead you down the road of, let's go someplace quiet. The less talking, the less stimulation, walk them or take them to someplace quiet and just be there and be quiet with them. ADHD. If someone has ADHD, they go into these emotional storms. There's not much you can do to talk them down. You just have to wait it out with them and they'll calm down. The manic patient becomes a threat. I think for your own safety, you need to get away from them. If you see them talking very quickly and rhyming and clanging, making words, bing, bang, boom, and they make these clanging sounds, and they're grandiose, hypersexual, impulsive, spending money, talking about erratic things, not making sense, you need to get away. As with psychosis, really you're not talking that patient down. You need to get away. That's a potentially dangerous patient. So I knew when I was on this mobile crisis team, when I had someone like that, where I saw psychotic disorganization, or they're responding to internal stimuli, staring off to space and talking to voices that aren't there, and turning their head when there was no sound, you have a dangerous patient. At that point, security needs to step in. You need to get away. And that person is an imminent threat to themselves and others. So no good will come of that. You're not talking that person down. It will not happen. Everything you say will further agitate them. Now, what do you do if you're at home? And this is the point of this lecture. And a family member, let's say you do have someone who's agitated. The first thing you say, what's upsetting you? And you figure out, you run through the list. Are they coming off of drugs? Are they on drugs? Are they autistic? Because you know your family member. Well, let's just say they're psychotic or manic. The best thing you could do, hopefully call the doctor or have some benzodiazepine, tell them to put it under their tongue and take enough of it till they go to sleep. And then restart their either antipsychotic or anti-manic medications. A lot of times you could just give them the full day's dose right there, or give them 2 days dose right there of their Latuda or Geodon or Abilify or Invega, whatever it is, or the Depakote, Lamictal. You can give them a bigger dose that day, and you can load up with either Ativan, Xanax, or Klonopin, or some benzodiazepine. Give them a lot. If they're withdrawing from drugs, you need to know which drug. And you need to deal with that drug specifically. If they're coming off amphetamines, cocaine, give them food, give them a cup of tea, tell them to lie down, sleep it off. If they're coming off alcohol or benzodiazepines, you have to give them benzodiazepines or alcohol, otherwise they could seize. If they're coming off opiates, pretty much at that point, it's a safe detox. It's not eminently dangerous, but they're miserable. If you can get your hands on some doctor to get you buprenorphine, or they're going to have 5 miserable days, and try and keep them hydrated and try and keep them, get some chicken soup in them, but usually they're in the fetal position, just sweating and in acute distress. But if you know it's opiates, you just leave them. It's alcohol or benzodiazepines, pretty much you got a problem where you either need to see a doctor or give them alcohol or benzodiazepines to stop it, because they could seize. Other problems you can run into. Key feature here is when I talk to families, and I'm always talking to them on the phone, there's something called expressed emotion. When you're dealing with the agitated patient at home, don't ever make demands, don't raise your voice, don't yell and scream, don't threaten. I'll call the police, we're going to get you Baker Acted or force you to go into the hospital using some legal means. That just sends them off. Don't do that. Even if you're going to do it, don't tell them. Hopefully you can get your hands on your treating physician or psychiatrist, and you can get the appropriate meds, the benzodiazepines, just to calm them down.